Welcome back. This video is going to cover the basics of red blood cell morphology. When we observe red blood cells under the microscope, we look at 5 different things to classify their morphology. If you look on the right, we have a dog's blood, and the red blood cells, as you can see with dogs, they have a nice central pallor, and they're all about the same size. They're a little bigger than cats, the red blood cells, which we'll get to species differences. But knowing your species difference, knowing dogs' red blood cells are usually all about the same size and uniform and have central pallor, we will look at the size, shape, color, and arrangement in relation to each other. As you can see, these have a pretty normal arrangement. They're not overlapping each other too much anywhere. I don't see any signs of rouleau. But we also may be on the edge of the monolayer. So these are all things you need to consider when you are looking at red blood cells, and also inclusions. So whether or not there is some kind of residual DNA or RNA in the red blood cell, or a nucleus, for example, or a parasite. Those are all inclusions inside of a red blood cell. When we observe cell morphology, we should be using an EDTA, purple top tube, with anticoagulated blood. EDTA not only keeps the blood from clotting, but it also preserves cell morphology. So this is the tube we use in hematology and with blood smears. Once you perfect the art of making a blood smear, it will have a nice teardrop shape, and it'll have 3 parts. It'll have the feathered edge, where most of the white blood cells have fallen due to their weight, and we'll have everything kind of crowded together there. And then you'll have the agglutinated body, which is the majority of the blood smear. And in between all of that, where the feathered edge is kind of spaced out and the body is very congested, you have the monolayer, where the cells are spaced out in what is a normal arrangement for that patient. So make sure when you are observing cell morphology that you are inside of that monolayer section. So remember, you got to take your species differences into consideration when you're looking at the cells. It's like we know cat red blood cells are already smaller than dog red blood cells, and dog red blood cells already have more of a central pallor, or that lightness inside, than cats do. So firstly, when we talk about size, we say when a cell looks the way it's supposed to, it's normocytic, it's normal size. Anytime you see cyte, it means cell in a word. And if the size is smaller than usual, then we're going to have microcytic, or macrocytic if it's larger than normal. And when we have a change in size, we call that anisocytosis. So if you have many different sizes of red blood cells, you have a good amount of anisocytosis. When we have different shapes of red blood cells, so we know that it's supposed to be a biconcave disc in canines and felines and humans and most mammals. When we have a size in that shape, we call that poikilocytosis. And there's many different variations of poikilocytes that we can see. Some of the most notable ones are going to be a Burr cell, which is something that can happen from error, also known as an echinocyte. And then we also have the acanthocyte, which has kind of abnormal projections. And we have target cells, which look like little targets, schistocytes, which are cell fragments, keratocytes, which can also look like they have like a little mouth. We have teardrop cytes that we call dacrocytes. And then we also have oval-shaped cytes. And there are many more. And these are all related to different kinds of conditions. For example, target cells can be related to liver disease, as well as acanthocytes. Schistocytes can be related to DIC. So again, we are always taking these things as only part of a puzzle. A red blood cell alone is not diagnostic by itself. And then when we're looking at color, we have normal color for that species. If the color is paler than normal, we call that hypochromasia, meaning that there is not enough hemoglobin, the patient's probably anemic, and they're not picking up the stain. And then when a cell has normal color, we call it normochromic. And when it has lots of color, we call it hyperchromic, right? Because chrome means color. and hyper means a lot or high. So hypo and hyperchromasia. And then when we have many different colors, if there's like some purple colors, some pale pink colors in the blood, we call that polychromasia, when there's lots of different colored red blood cells. Next, we talk about arrangement. In the monolayer, your cells should be spaced out from each other, and that would be normal arrangement. And sometimes we can see them in these strips where they kind of overlap each other, and we call that rouleau. And that can be common in some species as well, like cats and horses, but not so much in dogs. And also sometimes you'll see agglutination, which is not normal in the monolayer. And lastly, when we look at red blood cells, we look for inclusions, and these can be parasites, they can be leftover residual DNA or RNA, and you can also have the nucleus still in the red blood cell, and we call that a nucleated red blood cell. And then again, some parasites are intracellular in red blood cells, so you may see parasites as well in your erythrocytes. So that is red blood cell morphology in as much as I can summarize it up. And that is it. That is the 4 components of blood. If you want to know more, check out some of our other videos. And don't forget to check out our website for some cool vet tech products.